Welcome to another edition of Conversations with CASA. My name is Vicki Spriggs, and I'm the CEO of Texas CASA and your host today. My guest today is CPS Disproportionality Manager, Tanya Rollins. And Tanya's been in this position for almost a decade, so she brings a wealth of experience to this conversation. So welcome, Tanya.
Thank you. And thank you for always being willing to have the conversation. Thank you.
Absolutely. It's a conversation that is almost, I'm going to use the word banging, to the forefront right now, because as we look at the COVID-19 pandemic and how it's impacting low-income communities of color across this nation, and then we look at the issue of disproportionality across this nation, but now we'll bring the conversation back to Texas. As we look at disproportionality in Texas, we see that these communities are being hard hit, not only by the COVID-19 virus, but also by disproportionately coming in contact with our state's child protective services system. So yes. The overlap is not a surprise, but would you kind of talk about that with us?
Sure. So it's very interesting because a lot of people don't necessarily realize that we're not talking about systems working in silo, right? And so when we talk about this overlap between disproportionality and child welfare, the disproportionality that's occurring with COVID, and who's getting tested, who's being diagnosed, who's dying, who's more likely to die. One of the things I want to make sure I start with in the conversation is this isn't about people, right? So when we say this, and I say it's not about people, Vicki, is part of the conversation has been about low-income communities of color and what they can do differently, what we can do differently, instead of the fact that these communities have been set up in a manner through institutional racism and institutional oppression that makes them more vulnerable for this happening. And it's the same communities that are more vulnerable to coming to the attention of child welfare. We're talking about our low-income communities. And if you are low income, you're more likely to come to the attention of child welfare. If you are a person of color, African American and or Latino, and in some parts of the country, Native American, you're more likely to be reported to our agency and more likely to be investigated. And so these are the same things that have already set families up to be at the forefront of the child welfare system, and now they're at the forefront of COVID. We also know that our families are more likely to be your essential workers. And I put the essential piece in sort of quotations because these are individuals that were doing the work before COVID. So they were essential before COVID. We've now put a name to it. And so they are the ones who are more likely taking your public transit. They are more likely to be facing your economic impact of COVID and are shut down. We have so many different terms for whether we're quarantining, being shut down, whichever term you want to use, right? And so we know that these populations are the ones that are there. And when we start to talk about economically, we also know that studies have indicated from a child welfare perspective that if the child welfare system perceives a lack of resources, there's a higher likelihood of a child being brought into the system for safety purposes. So now we have to talk about COVID and the economic impact. We have rent We are about to face the first of the month once again. We know that our safety nets have not been put in place. There are individuals who have never received the stimulus check. There are individuals who have never gotten, what's the word I'm looking for, unemployment check or any sort of financial help during this entire crisis. Rent is coming due once again. We know that housing is a huge piece, especially when we begin to talk about sending children back home. We have to be able to talk about where are they going home to, and then be able to look at creatively, how do we make sure that this isn't a barrier to reunification? We know that most of our cases for fiscal year 2019, they were neglectful supervision cases, followed by physical abuse, followed by physical neglect. So when you begin to talk about childcare in the age of COVID, our parents are faced with some very difficult decisions. One, do I go to work? My children are out of school. Childcare centers are closed. And if they are reopening, is it somewhere safe for me to send my children to? We've been told to physically distance or socially distance. I prefer the term physically distance. So where do I send my children to if I do have to go to work? Because technically I shouldn't be sending them to the neighbor across the street or the neighbor down the street. I shouldn't be putting them with my elderly parents either. So our parents are in this very bad predicament. I like to say it's between a rock and a hard place, Vicki. So do I go to work, keep a roof over my head, put food on the table? Or do I not go to work and don't have those things? Or do I leave my children unsupervised and make a determination of whether they're old enough to be home alone and take the risk that something may happen or someone may pick up the phone and make a report of abuse or neglect? And then on top of that, we have food insecurity. So we know, and everybody has seen the pictures of these long lines at food banks across the country. We had food insecurity before COVID. COVID just put another notch to it. So when we talk about all of these things, we're talking about reason after reason for a family to become involved with the child welfare system, or for a family to have to, or a caseworker to begin to have to assess what are the safety concerns for sending children home, for your volunteers to be able to look at families and children and the situations they're assessing. And most of these issues are truly not within the scope of the span of control of our parents. It's kind of a long answer.
It's a long answer, but it's multiple nails hit on multiple heads, all tying back to systemic racism and the economic realities it's created, and now, and it shows up in many different facets of life. And
Yes.
and right now, you have this health system that is fairly expensive to access, and so when low-income essential workers and just individuals who don't have good insurance get sick, they're also the least likely to go to seek medical attention because it's pricey. And so you've got just compounded issue, compounded issue. But another issue that kind of ties into the economic discussion of that is the whole shift to virtual case management.
Yes.
Because the system, and when I say Child Protective Services, CASA volunteers, a whole bunch of entities shifted into virtual communication and contact once everybody started sheltering in place.
Yes.
And that's all well and good if you're in a well-connected area, you've got Wi-Fi, you've got a cell phone that's got a plan that actually gives you unlimited sound, or what do you call it, unlimited data.
Data.
But what does it mean for families that we're talking about here?
Yes. I'm so glad you brought that up. What it means is that our families may not be able to physically see their child. They may be able to write a letter, they may be able to talk on the phone, but they may not be able to physically see. And a virtual environment also means that in-person hug, that playing with my child, that bonding experience that we all know is very important. In a virtual environment, that's removed to a very great extent. One of the things that I think is really interesting is that I don't think many people fully realized what this digital divide was prior to COVID. It existed, just like all of our issues of systemic racism and oppression existed prior to COVID. COVID put a different lens on it. And our systems were not ready to live in a virtual environment, is the reality. We saw it with school systems. Schools all of a sudden realized that in order for a child to have a computer at home, you had to take a school bus and turn it into a mobile hotspot and send it into low-income neighborhoods. School districts realized that you had to actually give parents a hotspot to use. I think we all, when we talk about this whole conversation of biases and assumptions, Vicki, I think we all had this whole notion that if somebody had a cell phone, that was their window into the world. And I think you hit it head on a moment ago. It's only your window into the world if you can afford a data plan, a modem, internet service, and unlimited minutes. And I think what we all found out in Texas and across the nation is that we make a lot of different assumptions about where people stand in terms of technology. And that a lot of our schools in low-income communities, they weren't set up. They were set up for face-to-face. And the child welfare system isn't any different. Our system is built on the importance of face-to-face interaction. Our system is really built on this importance of knowing about bonding and best practice. And virtual has always really been sort of that sort of last resort, and it should stay that way, right? Although I think for some of our rural communities, the lesson learned is that virtual may work better for some of our families that have to drive extremely long distances to get to a courtroom and to stay in a courtroom. It may work a little bit better for families who would have to take off a half a day from work to go to a courtroom. And if they could be on a phone, right, for court, or somehow have a faster way of virtually being in a courtroom, it may work better. For our staff, it meant we had to have a conversation. We had to start, and I believe we've been really good with the guidance of starting with the conversation with the family. What are your options? From a technology perspective, what are your options? And then moving from there. You know, we always talk to a person first, talk to the parent first. And we've been doing that. And from there, we've been able to take it to, all right, you don't have the ability to do this virtually on an ongoing basis, but can we write letters? Can we do the phone? Where can we shift times, visitation times with? I also think that what also has come out of this is collaboration. The ability to work with foster parents and CASAs to find an alternative and make things work. I will say that in reading the literature, Texas has done better than most states in terms of our courts, and our courts really being able to say, we're not going to hold up permanency because we can't be in a courtroom. That permanency isn't about a building. So I think that's huge. I think Texas child welfare, we've also led the way in the sense of saying to caseworkers and to CASAs and to our other stakeholders, how do we make it happen? It's a virtual world. How do we make it happen? But how do we make it happen and understand that we're going to have to bend? And Vicki, I think both of us know that systems aren't necessarily good at bending. And I think in this situation, we have become relatively better at bending.
Yeah, I think that this COVID-19 pandemic has really made people, systems people, dig deep and figure out another way. Whatever they're doing, it is what is another way to make things happen. And in this instance, I think in keeping children safe, it is, well, you don't just shelter in place and then forget about the child. That's not happening.
Yes.
So it's what do you do? How do you leverage technology? How do you reach out to people who are partners and stakeholders and collaborators that you might not have relied on so much before, that you might need to start relying on more now? But I want to go back to that question because I don't know, honestly, I don't know if with the awareness that so many families are on the far side of a digital divide, and were unable to see their children because all they had was a telephone. Was CPS, I know CPS, because you just talked about it, adjusted how they outreached, but was there anything else they were able to do to work with families, or is that?
I think that was probably the biggest gist of it, right? I think it was really about working with foster parents, right? And perhaps, I know in some cases, if we could not, like absolutely, if there was no technology way, we tried to arrange some form of visitation, right? So that we were not putting anybody in a position where we were saying visitation just is not going to happen. And I think that was the huge piece of it. I think part of it is we became, we've been talking for years about this notion of foster parents and bio parents and caseworkers being, and CASAs being this team. So I think sometimes it was really about, well, what really, let's do as much as we can to think outside the box. But in a situation where we know that the face-to-face, the way you and I are doing, could not happen, let's make sure that so many other things happened on top of that. So let's increase the phone calls. Let's make sure, perhaps if you don't have the ability to do a virtual, maybe you have the ability to do a handwritten note. Maybe you have the ability to do an email. So let's really just figure out how do we maintain a connection, even if it's not a virtual Zoom or WebEx or GoToMeeting sort of phone call?
Gotcha. Good deal. Thank you.
You're welcome.
So, when I think about all of this, I am mightily aware that when everything shut down, parents who were under orders to get certain services weren't able to access those services, which creates a whole other dynamic that I won't even go into, because that's going to play out over time as well. But there are other stressors that are impacting, other stressors related to COVID-19 that are impacting the families of children in the protective services system. And I wonder if you have any thoughts about that.
Definitely. So one of the things I really think about, Vicki, which I think is really interesting, is I say take a family not involved in the child welfare system. Take every stressor that they are dealing with and then compound it with the stress of being involved with the child welfare system. Take the trauma of being in the middle of a pandemic and then compound that trauma with systemic trauma, separation trauma, and then really begin to be empathetic about what that must mean. And really understanding what our families are needing is they're needing us to really begin to work with them in a manner that's equitable. They're needing us to work with them in a manner that is family focused. They need us to work with them in a manner that's really very engaging in an empathetic way. So understanding services, you mentioned it. So I'm worried about being an essential worker. I'm worried about COVID. I'm worried about other family members. I'm also worried about my children. So every day you can go out to Twitter and Instagram and you see everybody posting their videos about how when this is all over, I will have gained this great bonding experience with my children. Our families don't have that. What our families have, our families who have children in care, what they have is the worry that my child is in someone else's care. And I don't know what that means. There is the pain of someone else is spending 24/7 with my child. I'm not having the Instagram or Twitter moment. And there's concern. There's concern about, I don't know who's going in and out of the home of that foster family. I don't know necessarily if my child is in a residential treatment center. Are they doing all of the possible precautions? You're talking about families with the stressor of lack of control. And if you're like me, I like control. Most people like some form of control. There's a huge stressor for our families on a pre-COVID level when there's no control. Now you take a pandemic and you put loss of control on top of that. It's huge. Then you have to also look at, then there's the judgments. Like, we have to be very careful about the judgments that we make about families and how families are coping in this pandemic. One of the discussions that is recently being held is for our teachers who are looking into people's homes every day with their children. And what are the judgments that you're making regarding the behavior Does mom look really stressed out today? Well, is she stressed out because she's going to work? She's trying to figure out how she's going to feed her children. So do we have an understanding of everything that you and I discussed earlier about all of those impacts and those institutional impacts on families? And then how, as professionals in the child welfare system, are we assessing those stressors? I think when we talk about our families, it's also the stress of, you told me as a system that there were certain things I had to do to get my child back. So now what do I do? And so there's this complete switch to virtual. And then some things I just can't do because some things just weren't open. What does that mean for my timeline? What does that mean for me getting my children back? And I think one of the questions that I think CASA has been good about, I think our court systems, I think our caseworkers and our supervisors is asking, why can't they go home? And what are the true barriers to safety? And let's really assess our true barriers to safety. And also taking the stance of, we and the courts have been great at this as well. Let's keep this train moving. Our families are already on the train. Let's keep it moving, because every additional day is trauma. It's trauma to the children, it's trauma to the bio parents. And we need to do as much as we can to keep asking the question, are they safe? And if they're safe, will they be safe at home? And what can we do to increase the level of safety so that we understand that our parents have this level of stress, and then how we interact with them. I had an advocate say recently, sometimes families just need 50 feet and a couple of days space. Mm-hmm. It's really that simple, that we as systems, we are constantly on families, but sometimes we just need to understand that trauma and stress are real. And we just need to step away for a moment. And one of the other things is, imagine living in COVID and living in COVID under a microscope. That's our families. They're living in COVID and in the age of COVID, but they're also doing it under a microscope. They're doing it under the microscope of a CASA volunteer. They're doing it under the microscope of a CPS caseworker. They're doing it under the microscope of a judge, of an ad litem. That would be overwhelming for anyone. And we need to be able to take that in and be very empathetic about people's reactions and not put our own biases and assumptions out there.
Well, I took a couple of notes. One, could have written down everything you said because it's all on point. But when you talked about trauma and stress are real, and I think that for so many people, I can't even smile when I say this. I'm smiling because I'm happy to see you. But the reality is, for so many people who looked up and didn't have a job the next day when all this started, they are becoming more aware of the impact of trauma and stress. Because they looked up, one day they had a job, the next day they didn't. And now suddenly the people that they probably talked about before, they see themselves there. Because now they find themselves yelling at their child, and they're like, oh my God, this isn't even me, but I can't control it right now.
Right.
Right? So, I mean, I think it creates some empathy in, in a strange and, unfortunate kind of way. And then I started thinking too about, we talk about stressors on these families, on every family. And if you look at just the news lately, it's almost like we've reached this point where people are really stressing out. And people who've been sheltering in place who might have had substance abuse issues, whether alcohol or something else, are, when you're sheltering in place and maybe because of economics, you don't have that unlimited plan and you don't have the internet. So
Right.
you're like, all you've got, it used to be talking to your friends, getting out to a support group, going to the gym, going for a run, doing these other things that got you out of the house. And now that option doesn't exist anymore. So we
Yes.
have, I mean, the stressors that are on all families generally right now, and all individuals are real, as they
And
say.
I think you also see that in the increase in our family violence, in
Yes.
domestic violence reports, in
Yep.
domestic violence calls,
Because those
when
have gone up.
they have gone up significantly.
Yep.
Calls to our hotline have not gone back up from their pre-spring break levels. We know that, but we also know that that means that abuse didn't stop happening. It just meant that all of those professionals that normally put their eyes on children aren't able to put their eyes on children. And so those same stressors that were involved before, but children were able to step away. Family violence victims were able to step away. You weren't able to do that. And I think part of it is, I told you earlier, I prefer physical distancing from social distancing because it's the wording of it, it's the meaning of it. And it's this piece about letting people know that you can physically distance, but let's keep working with communities about what are the places where they can call, where they can walk to, where you can have some sort of connection with someone. Because I think for some people, that's what's missing, is that sense of connection in some way. For some of our families, they were at the boiling point before COVID. And then we said, stay in a house, social distance, which for some people equates to isolate. And that's not safe. And that's not safe for a lot of families.
And I think that increase in domestic violence is being treated as domestic violence. It's not, nobody's thinking about, well, because you're called on the adults, not the children that are involved. And I think that well, you just read everything here nationally, everybody's expecting an increase because everybody saw that sudden decrease um, once kids stopped going to school and domestic violence starts going up, but nobody's calling about the kids. And so we know that the expectation is, anyway, that those
Yes.
numbers will increase, unfortunately. I hope by some miracle that's not correct, that people had frustrations, but they realized it wasn't on their children. But we all know that the reality is, you know,
Yes.
it's not happening like that.
Yes. And more than likely, I think a lot of our calls, when things finish opening back up, will probably be the realization of neglect, or what's perceived as neglect, and the realization that our safety nets, we have got to build safety nets that work. And a moment ago, you mentioned the individual who had a job yesterday and today they're unemployed. I think a lot of people are starting to recognize that the safety nets that you always thought was for other people is actually safety nets that are put in place so that when we get to these sort of situations, everyone can live a healthy life. And so when we start talking about advocacy for children, part of advocacy for children is advocating for safety nets, and safety nets that work, and collaboration that actually works. And us doing that before we become in that situation. I think one of the things I find so sad, Vicki, is the fact that sometimes in order for us to understand someone else's plight, we have to somehow end up in that same plight, instead of just recognizing that there are other realities and that people are in different plights than our own, and that we need to be working for a whole society and not just waiting for when we need the hand up.
Ditto. I hear you, and you're absolutely correct. Absolutely correct. I am coming. That was my last question for you. Is there anything else you'd like to add? Any other thought you'd like to share?
Just say, especially for your volunteers and your donors, that advocacy doesn't stop when the whole state is open back up. It doesn't stop when kids are back in school and universities are back open, and when you can go out to your local restaurant and sit on the patio. Advocacy for our children is ongoing. Advocacy for our children has to be about understanding that we have children that have disparate outcomes in our systems. And when we advocate for them and we improve outcomes for everyone. And that as everyone keeps talking about this new normal, we've been working in the old normal. I haven't seen a new normal yet. I've seen a new piece where we've been told to put on a mask, and people don't want to do that. We've been told to stay 6 feet away from each other. And in the grocery store, there's a piece of plexiglass. But in terms of how we really operate in systems and how we operate to one another and how we operate in terms of advocacy, we're not operating under that new normal. We're still operating under what was the baseline normal. So my takeaway from COVID-19 and my first pandemic in my lifetime is, if we want to truly create a new normal, we can do so. We have to have the want to do so. And that this is the time, and this is a time where voices are being heard, and that silence isn't an option. So use your voice.
Well, as I've said throughout this interview, well said.
Thank you.
Thank you. Thank you. Thank you for being our guest today. Thank you for bringing all of your experience and your knowledge and familiarity with the subject matter to us and sharing it with us. It's been really a joy to have you here today, Tanya.
Thank you. Great to see you too, and thank you for having me. And be safe.
My pleasure. Thank you. You too. And thank you for joining us for another edition of Conversations with CASA. We'll see you next time.